All right, everybody. So today on the podcast, we have Nick Licameli. How we doing, man?
Excellent. Happy to be here. Longtime follower. And yeah, it's awesome to be here.
Yeah, man. So you were just saying that you have been with 3DMJ for about 5 years, right?
Yep. Yeah.
So that's
3DMJ for 5 years. It's crazy how fast it went.
yeah. And now you're a DPT, right?
Yes.
So Doctor of Physical Therapy. When did you graduate?
2014
Okay.
with my degree. Yeah. And it's that has even flown by. To think, man, that's a lot of time. I'm sure you've felt this too with dentistry, but once you get out of school, time flies.
Yeah.
It drags in school, but then once the gates open and you just start that race,
Yep.
it just flies by.
Yeah, I actually enjoyed my time in school, but I find that, people talk about like, this quarter of your life, but I think it's more like thirds. Like you kind of got, up to 30 and then 30 to 60, 60 to 90, I think is like an interesting or good way to think about it. But really that career phase, because it's all oftentimes you're in the same place. So I think when it's like you're in high school and then college and then you're, dental or PT school and then you're in residency and whatever, and there's so many things that break it up, right? But when you're just like your career, if you have like one or two jobs that whole time, you think back, you're like, holy crap. Like same thing we were talking about where we live, right? And location. If you've moved around all the time, like I've lived in 7 different states. So when I think of 3 states ago, it's like that seems forever ago. But when I think of the one state, even though I've been there for 4 years now, it's like, wait a minute, I remember when I just moved in, right? So I find that when people kind of get into that career mode, things just zoom by.
Yeah, and I think each of the phases comes with a bit of leveling up, and I guess that's probably a good place to start. uh, so yeah, I think whether it's bodybuilding or whether it's a profession or whether it's just life and starting a family or getting married or going from high school to college, uh, you just keep getting that uncomfortable feeling and then
Hmm.
you overcome it. And then that becomes your norm. And then you go on to the next thing and the next thing. So I think what I've found is that you have to be comfortable with that and you have to expect it. And if you're not pushing that edge and if you feel comfortable and you're not ever questioning things or feeling like you don't know what you're doing, whether it's raising children or starting a new job or opening a new business. And if you don't get that nervous feeling like, oh my goodness, of what did I get myself into? I feel like you're probably not doing enough, like I feel
Yeah.
like you have to always push that.
Yeah, no, it's good. And, we'll certainly dive into like more bodybuilding stuff and like some of the PT stuff. But that is an interesting just life point because I've talked to a few friends about that recently where it's like, I'm kind of in a good position in a few different areas and I could just kind of coast, but then you don't, and like I'd still be doing well, but you just feel like you're not doing enough. I made a post, I don't even know, months ago now that I said, if you're constantly getting to the end of the day where you've checked off everything that you can think of to do, you're probably not doing enough, right? Like in reality, the most productive people have so many things going on at one time. You could always be doing more. And that's something I struggle with too, is being able to take the time to live in the moment and relax, even though there's 20 other things I know I could be doing.
Yeah, that is I couldn't agree more. Because no matter what, that's all we have. But it's that moment. And it's funny. I'm glad we're talking about this stuff and not only like muscles and joints and
Yeah,
things
yeah,
like that.
sure.
Um, so I have two daughters, 3 years old and 2 years old. And what what I've kind of been reflecting on is I look back on my like home videos when I was a baby. And I used to always love that. And I would always say, gosh, I can't wait till I make those for myself and for my family. And you're a fan of Harry Potter?
My sister's a huge fan of Harry Potter, so by proxy,
All
I
right.
know quite a bit.
Well, there's this scene. I'm sure 90% of your listeners will know this. There's a scene in the movie, The Prisoner of Azkaban, where basically they time travel. And basically Harry is dying. And there's like this mysterious thing that comes in the woods and saves him. He doesn't know what it is. Then they go back in time. And long story short, he is in the woods watching himself die.
Hmm.
And Hermione, who's with him, is telling him, like, you need to save yourself. And Harry's like, no, 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 like it's going to happen. It's going to happen. Like, I know this thing is going to come save me. And she's like, no, 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 you don't understand. You're the one that saved you. Like, you need to step up and do this or you're going to die over there. And that's so true, because looking back on like my home videos and family photos and things like that, if I don't take the time to do that, it's not going to happen. Like, I'm the one now that has to live in the moment and understand that if we're having a family party, I can't be focused on the fact that I have an athlete to jump on a call with, or a patient I have to treat, or documentation I have to do. Like, I'm sure my parents had things that they had to do too, but they took the time to make those memories. So yeah, I think living in the moment is something that can kind of transcend every aspect of our life, and especially in the weight room. Because if you don't love that journey, if you're just focused on like the next thing, or some kind of illusional goal or physique that you want to reach, you're not going to enjoy the ride. So yeah, man, I think it's really important to stay in that moment, and yes, juggle a lot of things, and pursue all of your ambitions, but then staying present is definitely the most important thing.
Yeah, it's very tough, I think, with lifting, and it's very understandable that a lot of younger and newer lifters just want to get to this next thing and this next thing, because, well, like, how long have you been lifting, Nick?
I mean, in high school, we used to work out for the football team. My brother and I used to watch Rocky a lot, and we used to train in my parents' garage. But I would say, seriously, I picked up my first issue of Muscle and Fitness magazine in 2008. So I was graduating high school, and that's when I really dove in hard. Like, I was just, those first issues of the magazine that I got.
Yeah.
If I look back on them, there's highlights and underlines and pages folded, and I just remember that I dove so hard into that. And yeah, it's bro science, but it was something for me to latch onto. And that really scratched that itch for me at that time.
So 15 plus years, right?
Yeah.
And that, I think back, and it's, probably part of it's a little bit of rosy retrospection and whatnot, but you look at those periods of time, and I just remember always being discontent with the progress. Like, I wanted more. But now at my current age, I look back at that and I think, man, like, that was such a wonderful time. And that's something I really do try to get across to people on the channel, is just, if you are in those first, even like the 5 years or so, that you'll never have that period again. And even if you're, quote unquote, only gaining 5 pounds of muscle a year or something like that, like, that is not going to happen later on, right? I mean, if we can gain 1 pound now, it's awesome. So, the Muscle and Fitness magazines, T Nation, I don't know if you remember bodybuilding.com, they used to have, there was a video, a whole series with Milos Sarcev, and he walked through like this, and like, I just remember being so enthralled, like, watching these things, and it's just an amazing time. So it is so important to try to, maybe focus on an end goal, sure, but just realize that, like, that process is everything. I mean, that's what it is. And it's tough, though, to convey that to an 18-year-old who just has to get bigger now because he, wants this girl to notice him and whatever. It's tough.
Well, that's the thing. I feel like there's no lack of information. There's way more information now than there was when we started, but I think it has to fall on fertile soil. And I think if I was exposed to 3DMJ at 18, 19, I would have been like, I don't want to follow these guys. Like, they're not cool. Like, I would want to go in the magazine and, like, I mean, Jay Cutler does this workout for his arms. Like, why would I follow Eric Helms? Like, I don't even know who that guy is. Right. So I feel like you have to be in the right phase. You have to be ready for it. And there has to be some kind of maturity that happens. And you have to make some of those mistakes. Like, one of the first things, first pieces I've written for 3DMJ was called, I'm thankful for the mistakes of the past. There's a 2-part blog. And basically it went through things like that and different mistakes from the bro science days and the post-workout window, and always training to failure, and going into GNC and just spending $200 on different kind of mixtures and things like that. But because of that, now you can kind of learn from that and look back. And now when we approach something like reps in reserve, you know what it feels like to go beyond failure. So now you know how to gauge that. Or if there is some kind of supplement that pops up on social media, you know, your first thought is that's probably not true. Like that
Mhm.
claim probably isn't true. Let me look deeper. Even like another analogy would be like a very sheltered teenager, you know, Catholic school, strict parents, and then they go to like University of like Florida or like Miami or something, and they just go crazy, like keg stands, like alcohol, drugs, and they just go off the rails because they
Right.
never made those mistakes in a
Right.
more controlled environment. So yeah, I think as much information that's out there, and I do think the I do think 3DMJ. I think we have a pretty good reach into the younger generations. I feel like
Yeah.
we are more of the first entry point into fitness than we were in the past for sure. But I just feel like it's got to fall on fertile soil, and we could only do so much to our seed, and the soil is kind of up to the environment, I guess.
Yeah, I mean, I first came across 3DMJ back in 2011 or so, which is funny. I think I was telling Alberto, he was, I believe, 28 at the time. And I remember seeming like the older guy to me. And, I'm 31 now. So I was just like, geez, man, time is flying. But to me, I really did like their content, but I also was a little bit atypical. I was 20, 21, whatever I was at the time. And I think most of my friends were looking more at like the bodybuilding.com stuff, or I remember this one guy just being, I was shocked by his just, I don't know, his reluctance to look at something like a 3DMJ. And he was like, oh, look at this, like, look at Jeff's side, bro. And it was just, and this was like not a dumb friend of mine. So it was very shocking to see that. But I do think, yeah, I mean, all of the 3DMJ guys have pretty big followings. I think there's still a name that a decent number of people know. But yeah, man, it is all interesting to see the progression of things, and once upon a time in high school and all that. But I think it's important to go through those phases because, like you said, you can kind of see as you come out the other end a better idea of what is legitimate. And also you get this where I don't know if you've noticed this, but in the last few years, you get some of these people who come into this space, but they're not like, let's say, an Eric Helms, where they've been in this game and like really looking at the research and the evidence for a long time, but they're tangentially related. So like an Andrew Huberman would be an example, right? Where, he's talking about this palm cooling device and just these amazing gains from this palm cooling device. And this one athlete, he went from doing 147 dips in a workout to doing 600 dips the next workout, and all this stuff. And like, you just hear that and you think, okay, anybody who's been in this space for a long time just knows that that's obviously ridiculous, right? But I think if you're just new to this, you're like, oh, well, this is a smart guy and he's got a PhD and he knows these other areas. And we talk about something called promiscuous expertise, right? Where somebody is an expert in one or two areas, they start talking about other areas, and somebody just assumes that they're necessarily correct in that. And fitness is such a popular thing. You get some of these people who come into this space, and if you're not super involved in it, you might not know it's not necessarily accurate,
Yeah, I think it always amazes me once we step out of our circle, how different the actual world is. Like the questions that I'm sure you field from friends, family, are just kind of like make your head tip. Like, huh? Like, what? Like, is that really like? Is that not well known?
Yeah, yeah.
But it all comes with the progression of your I guess thirst for knowledge, and I think this kind of growth that we're talking about, I think it's very similar to my experience in physical therapy too, and possibly even yours with dentistry. I mean, in school, we're taught to be kind of like mechanics, very like tissue based diagnoses, very specific tests and measures to pick out the tissue, the joint that's the problematic area, and then we have these specific interventions and manual techniques to fix them, and you leave school like thinking you're gonna cure the world like with these hands, and I can't wait to go to family parties and people ask me about their pain, like line up across my grandmother's dining room and like come to me and I'll fix every pain you ever had. So that's kind of like the muscle and fitness bodybuilding.com T Nation stuff. Like you just dive into that and it's so like I don't know, delicious. Like it's so satisfying to consume that kind of knowledge. And then you feel like you're a level up from the world and you want to just give everyone this cool information that you have. And then you realize, oh, wait, maybe this just, there's more to this. Maybe this isn't the case. And then you start to dive into some research yourself. And then you see other resources, other mentors. And for me, I kind of got to the point where the magazines were kind of repeating themselves. And I knew what they were telling me. I knew it all. And I was probably the highest level of muscle and fitness education I could possibly get.
Mm.
And then, do you remember Jim Stepani?
Sure.
So Jim Stepani was my first outlet to getting out of the magazine and following someone with a PhD. Mm-hmm. And I said, all right, here's a guy who is in the lab. He's got, his ear to the pavement, and he also looks the part. He's got a doctorate. This is my guy. And then I kind of latched on to him. And that was maybe like a step up from muscle and fitness. There's still some like bro-ish science to it, but that kind of satisfied that itch for me there. And then I looked to like T Nation, and then you stumble across like Brett Contreras and even Brad Schoenfeld every once in a while, and Alan Aragon. And then that opens that world. And then I think I found 3DMJ from Matt Ogus around 2011, like around that time. And then that just completely satisfied that itch for me, because that's just what I was looking for at the time. Right. And same thing with physical therapy. You come out of school and maybe you have a mentor, and it's like the biggest guy in the gym, right? They're successful. They've been practicing for 10, 15 years, maybe a business owner, and you just follow them and what they do, and they teach you. But maybe the biggest guy in the gym isn't the most knowledgeable or the most evidence-based. Maybe he's getting results despite his methods, just like maybe the physical therapist is getting results despite his or her methods. So then for me with physical therapy, it was kind of getting into that online community, barbell medicine, clinical athlete, E3 rehab. Those are kind of like the 3DMJs of the physical rehabilitation world. So you kind of dive into those things, and then you have that existential crisis, just like when you dive into 3DMJ and you realize, oh my gosh, a lot of what I've been doing and what I've been thinking has been written in stone, possibly isn't. And then once you go through that crisis in your mind, it also prevents me from feeling too sure about things in the future, because you know that feeling of getting flipped on your head. So yeah, my journeys through both of those things have been very similar.
Have you found with physical therapy that, because I mean, really, whether it's fitness or medicine or PT, there's, this evidence-based content, but then you find that, okay, well, maybe there's these things that a lot of people claim work, but they don't have a lot of evidence, or vice versa, right? One of the issues I have with physical therapy, and I'm actually going through this now with myself. Let me pull out this book. I don't know if we can get into your thoughts on Stu McGill here, but I got Back Mechanic. I'm like halfway through here. But I've been dealing with some pretty chronic back issues recently, and it's probably a combination of my profession along with just maybe not having, I wasn't really doing a lot of direct core work. And I think because I used to just, I was young and I was like, well, I squat, I deadlift, I do pull-ups and overhead press, so I'm good. But then I stopped doing as much squats and deadlifts, and I think that was maybe an issue too. So we can talk about that. But the point more just being that it seems like with physical therapy, a lot of the issues is that you have stuff that works, but it's not necessarily like somebody comes to me, they have an infection. Okay, we're going to do this. We're going to clear out the infection. Maybe we'll give you an antibiotic. Done. And it seems like with pain specifically and PT as well, there is this issue of a lot of confounders, right? There's regression to the mean, which for people who don't know, it basically just means, you might go to your physical therapist or your doctor when things are at its worst, but there's going to be a natural fluctuation. And so you go when things are at their worst, it might naturally fluctuate back down to its average point, but then you think, oh, well, it got better, right? There's a lot of placebo involved. I mean, how do you feel about that as a physical therapist who's seeing patients all the time?
You hit the nail on the head. I think the issue with our profession is I think it's impossible to rely too much on evidence, because at the end of the day, just like strength and conditioning and muscle growth, it's not a very like if we're talking about world problems,
Hmm.
it's not, we don't have fantastic evidence to say, okay, this is definitely the answer. And like you said, something like pain tends to get better most of the time, despite what we're doing. So we can throw a lot of stuff at pain, and it can kind of just get better. And then we develop those narratives about why my waving my magic wand over you got your pain better. Then I can create a narrative. But I think the problem is the stakes aren't high enough.
Hmm.
And if you compare it to something like cancer research, I don't know anything about cancer research, but in my mind, if you go to 10 different physical therapy offices and have back pain, you'll
Hmm.
probably get 9 different diagnoses from those different therapists, and probably 20 different treatment approaches to that back pain. And maybe most people will get better. The problem is when you compare it to something where the stakes are higher. So imagine you went to 10 oncologists with lung cancer. I can almost guarantee you'll probably get the same diagnosis, same treatment. It'll be something similar because the research is just so much more clear, and we're innovating constantly with something like cancer. So if oncology was like physical therapy, there would be practitioners in jail, like making up false narratives about how to treat their
Yeah.
cancer. People
Yeah.
would be dropping dead on the street. So I think that's a problem. Kind of like you said, you have regression to the mean where things just kind of get better. And back pain, knee pain, it's not really something that is going to, end someone's life. So yeah, I think that opens the door for a lot of false narratives, and then people can just create their own courses and camps of thinking,
Right.
and maybe it's based off of the same principles that work, but then the reasoning behind it perhaps is not accurate. And the problem that I have with that is something like, say, joint manipulation, like cracking joints. Um, yes, we know it feels better temporarily. We know that it can improve some range of motion. Um, we don't really know why, but it's kind of like a control alt delete. If something's really painful, really stiff,
Hmm.
and I crack your back and it feels better, great. Now let's get into some stretching, into some progressive loading. Beautiful. We've used it in the perfect way that it should be used. The problem is when you take that result of decreased pain, and then you tell the person that you just realigned their vertebrae in their back and they were crooked for their whole life, and now you just realign them, and lo and behold, their pain is gone. Oh, by the way, but you have to come back 3 times a week for the next 10 years so I can keep adjusting you.
Yeah.
Then
Right.
that narrative then creates that kind of dependent relationship with that practitioner. And sometimes I think so. Someone like Stu McGill, it's clear that. So one step back, I think you have in fitness and in physical therapy, you have some of the people that are deliberately out there to scam people and just make money. Then you have the people out there that truly, honestly, are trying to help, but maybe don't realize what they're saying is maybe not accurate. And then you have the other people who really try to be the best that they could be. They admit when they're wrong. They're not married to any concepts. I truly think Stu McGill is one of the good guys out there. He's not out there to scam people. He gets great results with what he does, and his principles are sound. I think that 90% of what he says is, I would shake my head and say, yeah. I mean, I think that's a great option to treat back pain. And I don't know too much. I haven't gone too deep into his work. But yeah, I think if someone were to stumble upon Stu McGill's work and that was their first entry point into their back pain, I think they're on the right on the right path. I think people sometimes just get so caught up in that 10 to 5% that may not be what they agree with or what they read in the most
Yeah.
recent
Yeah.
study.
Yep.
And then they're like, oh, this guy's a quack. I don't
Yeah.
really agree with that. I think there are a lot of people that try to do good, and it's hard to have all the answers, right? It's hard to kind of set your foot down and create books and create courses that are accurate and good and helpful, and then turn on that when new evidence comes out. So it is, I do give most people the benefit of the doubt when it comes to those things. And I like fielding questions, because if I don't know the answer, then I don't know the answer, but I can tell you why I don't know the answer. And I can tell you my thoughts in my head, what I'm thinking. So yeah, man, it's tough, but I think most people out there are trying to do some good. It's just tough, especially in something like physical therapy, when pain is so
Yeah, for sure.
impacted by many things.
I think, yeah, like with Stu, obviously he's got a very, long lasting, or a very, I'm trying to think of when he first came into the, I don't know, the space. I mean, he's been doing it a long time.
Long time.
Obviously. Yeah. But I would say with Stu, I first came across him actually when Lane Norton was going through his back issues. And I think he went to go see him. And then he's got workout with Brian Carroll, who I'm actually going to have on the podcast, because he had to help him kind of rehabilitate after some severe back issues. And I'd like to get Stu himself on the podcast. My understanding is some people's critiques are that some of the reasons he gives are not necessarily accurate in their mind. But again, that's out of my wheelhouse. So I can't really comment, here or there. But yeah, I think it is tough when you have something where there's, like you said, you can just kind of design your own course, right? You can say, yeah, I mean, and even not even necessarily a bad thing. Like I think Precision Nutrition, just as an example, outside, just for nutrition, they have their own course, and now you're Precision Nutrition level 1 or 2 or whatever. I mean, that's just something that they just made, right? That wasn't like some governing body that has this or anything. That's just something that they kind of made up, and it doesn't mean it's wrong. It's just, where's the oversight there? And like with medicine, you kind of have that issue with like functional medicine practitioners, right? And maybe some of the stuff that they recommend is good, but you have all this stuff that could just be total nonsense. And how do you vet that without the background? I mean, like and probably you and like generally more informed people might be able to say, yeah, like this really is not evidence-based. And not to say that every single thing somebody tries has to be completely evidence-based, but you know what I mean? But yeah, once you start getting the pain and everything, it's just, it is so difficult. I saw for a while, I had done ART, or active release technique, and like Graston kind of falls in. Where do you fall with that kind of manipulation type work?
Yeah, I think it's a tool. I think it's a tool in the toolbox. I think if someone comes in, so I'll give you two scenarios. Someone comes in, high level weightlifter / bodybuilder, and they develop some back pain. They're able to function throughout their day. The pain isn't keeping them up at nighttime. They don't have any pain shooting down their leg. No red flags, but at the bottom of a squat, they get some pain in their back. That person, to lay them on a table and scrape their back or massage their back for a half hour is probably doing a disservice. That person, I think, is past that step, and they need to work through some graded exposure to that deep squat position, and possibly some look into the overall volume, some of their training techniques. Contrast that with someone who comes in with, we'll say, like really bad knee pain, and they're limping in the door. They could barely stand up or sit down. So we finally get them on the table, and you try to just kind of take them through some range of motion, and it's really flared up and really stiff. Okay. Why don't we start with some feel-good modalities, some things that will just kind of lower that guard a little bit, because this area right now is very tense, very protected, very guarded. Graston, ART, electric stim, heat, ice, joint manipulation, what else? Vibrating foam rollers, Theraguns, like all that stuff. Heck yeah, like use it all. I don't care what you use, like icy hot, like use anything you want just to calm that area down. And then once we calm that down with all those techniques, then maybe we can start doing some gentle like knee extensions, or maybe like a sit to stand from a high chair or something like that. So they should be used as almost like to unlock some more function, to let us do more in the gym or in the clinic. Yeah.
Those areas are interesting. There was, you were talking before about like the joint manipulation and like cracking and whatnot. And so I know chiropractors have a very mixed reputation, and most physical therapists I know do not like most chiropractors. Um, eh,
I love everyone. I love
sure,
everyone.
sure. But it's funny because I mean, again, like you said, you think if you went to an oncologist or if they went to 10 oncologists, it'd be very similar. I'd like to think that. I don't know if that's completely true, but I'd like to think that. But with chiropractors, I've gone to three, I think, over my life. And one was when I was young. I was like sixth grade. I quote unquote threw my back out, literally just picking up a basketball. Like I just like couldn't get up. And so that was interesting. I don't know if it was just from wrestling or what, but later on, well, and I'll start. The last one I went to definitely fell into that kind of kooky category, I would say. Kind of the category of I don't want to say like a total charlatan, but man, like all the stuff that you think of when you think of a guy who's just kind of pushing nonsense. Like he had like two high school assistants and then just left me with them and had some ultrasound wands that like would roll over me and just a lot like suction cups. And I was like, all right, man, like I don't, and whatever you can bill to insurance, I guess. But the one guy who I went to, who I thought was pretty legit, but that was just based on the results I seemed to get. He was a chiropractor, but he seemed to step away from the standard chiropractic work. So he was doing more like I was asking about ART at the time. And it's one of those things where it's like, I can't tell you what the evidence for this says. All I can tell you is that I had this pec issue for a long time and this lack of mobility. And I'm sure this is not a long-term fix, but he did something where I was trying to see if I could touch my hands behind my back. And then they were like 10 inches apart. And he did 6 different things that by the end of the session, they could touch, which could totally just be some manipulative way to say, look, like here's something that shows something worked and not actually help me long term. But either way, I was like, that was actually pretty impressive how much that just increased the range of motion. But it got me back to benching. This was when I was trying to hit like 365 on bench. And so all of a sudden, it was whatever he did was working. So as much as I am a big fan of evidence-based, if you have an issue and you go to someone, whatever they're using, if it fixes it, even if it's placebo, I would say it's worth it. And for me, it was worth it, you know?
I'm with you. I am with you. I like to think that I lean toward the evidence-based practitioner. However, everyone's different, man. Everyone is so different. And if something works for you, that's the best option for you. And placebo or not, I don't care. Like, honestly, like if my shoulder hurts and you sprinkle pixie dust on it and it feels better, perfect. Save that pixie dust, because if anything ever happens again, you're putting it right back on the shoulder.
Right.
But then I guess the narrative is what we have to watch out for. So now if he said that he readjusted your scapula because it was asymmetrical and what he did was, then he kind of went down that rabbit hole, then I would say, well, let's just pull back here. Let's just keep it as we did something, it got better. Let's roll. Like that's kind of all we can say. And also buy-in is super important. So a very charismatic practitioner or someone who seems confident in what they do, or someone that you feel comfortable with, not you specifically, but someone that people feel comfortable with, they will have better results with that person, even though they may not be so like evidence-based, with someone who they don't really have a connection with or a therapeutic alliance with. So yeah, I think that's something that I've even done in the past. Is if someone comes in, and because sometimes that's the expectation, that they want something done to them. They want that quick fix. They want that crack and a snap and a muscle release. And I do some of those things. But if that's all that they're looking for, and they're not really into the graded exposure, loading, things like that, sometimes I'll just refer them to a colleague. Like I'll say, hey, like totally cool. Like, here's a great, acupuncturist that I know. He does cupping, does acupuncture, does some like ART stuff. I think you'd be a great fit. I'll give him a call and like set you guys up with an appointment. And then I'll be here, if you ever do want to come back and things like that, because I don't ever want it to seem like I have the answers. And then all those other things are like snake oil salesmen, because it's not the case. If that worked for you, you should confidently tell the world like, hey, I got ART and it helped me bench again. And if anyone says, oh, you got scammed or that's placebo, who cares? Like, it worked for you. And there's value to that.
Yeah, yeah. I mean, the belief is really important. I mean, if you really want to get into a category of treatment that is, I don't want to say highly placebo influenced, but the area of psychology and therapy. I mean, if you actually look at the evidence there, there's so many different things. There's CBT and all this, but really the number one factor for if somebody is going to improve with therapy is one, if they believe that they can improve, and two, their connection with the therapist. Right. So you think like, oh, this person's had training for 20 years and this is this and they're certified in this and this. And it's like, all right, well, basically, you just need somebody who connects with you, listens to you, and you believe that you can improve. Right. And so, you can get into a whole rabbit hole with that. But
Yeah, and it's amazing if you think about that. Like that is huge, and I feel like people don't appreciate that enough. Like that the kind of like whole biopsychosocial model of pain, and it we once we look at it across other body systems or mental health, physical health, it's all the same body and all. So I think, yeah, man, I think that can't be overstated, and that's probably why people like Stu McGill have such success, because the guy's been out for so long. He's seen it all. Like you talk to him and you're just like, this guy knows what he's talking about. And yeah, man, I think that goes a longer way than people like to think. And I've seen it happen. I've seen me just having a conversation with someone and explaining some things and giving a bit of education, some reassurance, a tissue to cry. Like this happens all the time. In my day-to-day practice, when you dive into Simon Sinek? He's an author.
Start with why.
Start with why. Yep.
Yeah.
You kind of have to take that approach when it comes to this stuff, because yes, the what. So there's the why in the middle, the how, and then the what. It's like a bullseye kind of. And the what is the pain. All right, we have this pain. Great. But that's not the goal of you going to physical therapy. The how is exercises, modalities, things like that. But the why is because I want to play with my grandkids in the yard, or I want to walk my daughter down the aisle at her wedding.
Mm-hmm.
That's the why. And you need to get to those things to build that relationship, to build that therapeutic alliance that we're talking about. Then you can work on the how and the what. But too many times it's just shoulder, rotator cuff, muscle, strengthen, cortisone injection, surgery, and it never gets deeper. And I think we're missing that connection. And it's not so much a dig to practitioners, because the way that our healthcare system is set up is usually we don't have that much time to spend with people.
Yeah.
So yeah, but yeah, I think we have to get that connection, whether it's a coach, an athlete, or a healthcare provider. We have to make sure we remember that there's a human in front of us with a history and with prior expectations and with goals, and yeah, man, you really have to get down to that. I'm sure you found that in coaching and dentistry as well.
Yeah, no, for sure. I mean, there's so much more to it than just having the knowledge base. Man, I've had numerous clients and patients who have left other offices or come to me, and it's not that the work was bad. It's just the bedside manner was really poor, or they just didn't, it's things weren't explained to them properly. I mean, it's unfortunately, like, you'd like to think that, oh, if I just have the skill set, then that's all that matters. And if anything, I don't want to say it's obviously not the least important thing, but it's not the most important thing in terms of patient or client satisfaction.
Yeah. Yeah. There's a surgeon I'm thinking of in my area. Obviously, I'm not going to say his name, but I treat a handful of his patients. I've shadowed him for a day, which means like I basically volunteered, followed him around. I think in like 4 hours, he said 2 words to me, and that was it. And I was just basically like jogging to keep up with him, like down the hallways of his clinic.
Yeah,
but the guy does great work, like total knee replacements, like incision down the knee. In like 3 months, you can't even tell the guy he had surgery. Like the guy is just a great surgeon. But when you ask the patients, like, what'd you think of him? They're like, oh man, like he's great. Like he did my neighbor's knee, and my knee feels great. Like, but he's not much of a personality, or much of a talker. And I guess it depends what it is. Like if you're going to a general orthopedic for some mild pain, maybe you want more of that bedside manner. But
Yeah, if I'm
if
going
you're
for brain
getting
surgery, I don't really care about your personality, you
exactly,
know?
exactly.
Yeah, yeah, for sure. So how do you treat clients and patients in terms of like I know you're obviously part of 3DMJ. That's not what you do full time, is it?
Right. So I am a partner slash owner of an outpatient orthopedic physical therapy place. That's what I do with most of my time. I'd like to say 9 to 5, but it's really all day long that
Okay.
I'm thinking about it or doing some kind of community outreach or reaching out to different
Yeah.
doctors. But that's the fun stuff. Like I like getting out of the four walls of the clinic and kind of
Yeah.
growing a business, and I enjoy that a lot. Watching something go from a blueprint that was a furniture store to now it's this fully functioning PT office,
Yeah.
and uh and and it's cool to set the tone of the environment. It's cool to um uh be the leader in the place, and just kind of set the mood for when people walk in, for that like just good environment for healing.
Yeah.
Everyone's laughing, it's fun. So I do enjoy the business aspect of the clinic. That's what I do with my as my full time job, and then the 3DMJ work is on the side.
Okay.
And also the BFR Pros. I work with Dr. Nick Rolnick, and before COVID, we were doing a lot more in person presentations and traveling. We went to Paris at the end of 20, excuse me, a couple years ago. But yeah, 3DMJ is more on the side of my full time job. But the cool thing is that I was getting into telehealth with 3DMJ in 2018. So
Hmm.
I dove hard into telehealth, learned everything I could know about it, and had some experience already. Then the pandemic hit and
Sure.
everything went virtual. So I was in a nice spot because I had all this experience with
Right.
virtual treatment. And it also was about the same time when I started doing less with my hands and more with education, guidance, that kind of thing. So virtual really worked out well for the right time in my career, because
Yeah.
I was starting to see how much a narrative can help someone, and some guidance and just some home exercises and some tweaking here and there can go a long way. So I really don't treat, I use the same principles that I do with a professional bodybuilder with 3DMJ as I do with the old woman who comes in with a walker. Same principles. It's just different, like I guess different what's in that target of why, how, what.
Yeah. Yeah. How many partners for your practice?
So I am it's a bigger company with offices up and down the East Coast.
Oh, okay.
My office, I have a share in my office that I'm in.
Gotcha. Gotcha. Okay. And then do you also have training clients as well, or is it all like PT?
I don't have any like coaching, just straight up like personal training or coaching clients. Although it kind of turns into that sometimes when you have someone who's rehabbing from something.
Yeah, sure.
If they're not getting coached already by one of the coaches at 3DMJ, if they just come to me because they heard of me on a podcast or something, then I would, it usually merges into their training. But if they're getting coached by one of the coaches already, then we'll all kind of sit down virtually and have a conversation about the athlete. And then I'll just kind of give some guidance to the coach and different things that we could tweak or possibly change. So yeah, it's kind of a mixed bag a little bit there, how it all like walks off into the sunset.
Sure,
But
sure.
it kind of merges in like a little kind of a gray area.
Yeah. So would you say, I mean, obviously with 3DMJ, you got a lot of people who are pretty serious lifters. Would you say there's a most common issue you end up having to address? I mean, obviously you're virtual, so there's only so much you can do there, but is it like shoulder issues? Is it back issues? Is it like just a form issue? That what is the most common thing you see?
I would say probably
Hmm.
lower back pain, and then shoulder is probably the next one.
That non-specific low back pain, right?
Non-specific low back pain. That's the answer right there. That shows that you are evidence-based, but also have no idea why the person's in
Right.
pain. Yeah, and most of the time, if it's a high-level athlete, we can find some things that trigger it. First and foremost, rule out red flags, right? So any kind of pain that really has no rhyme or reason. You can't reproduce it. You can't make it better. Wakes you up at nighttime. hurts during the gym sometimes, other times it doesn't, and it's just constant, like constant throbbing, that kind of thing. You want to get checked out, because that doesn't jump out as musculoskeletal pain. That we want to make sure it's not something more sinister, tumor, fracture, or something like that. So once we rule those out, then we kind of dive into just what makes it worse and what makes it better. And then maybe it's a range of motion thing. Maybe it's a proximity to failure type thing. Maybe it's a load thing. And we can kind of use all these pieces to make a little modification and then see how it feels, and then kind of just work our way back up out of those modifications. Of course, we're juggling life and things that reduce our capacity, and stress and sleep and nutrition, hydration, all those things. But most of the time we can find a few things that we can modify, and then in a kind of strategic way, work to regress or progress as tolerated. Sometimes it doesn't work. Sometimes it just gets worse, and the pain is just so debilitating. It starts to seep into daily activities. And then that's when we say, okay, maybe we should go see a doctor in person. Maybe we need a little injection in there just to kind of knock down that inflammation so we could kind of start over. Maybe some medication. Maybe we do need some imaging. So those things have their place for sure. But I think maybe sometimes they get used too quickly.
Yeah, I think that is interesting. And I've been listening a little bit more with barbell medicine and whatnot, and they seem very much in the camp of this slow integration and like trying things out. I always wonder though, because there are instances where it seems like people, whether it's a shoulder issue, obviously back issues can be very complicated, where they will have some pain and just any movement of that type causes that pain, and they rest for a while and they reintroduce it. I mean, I have two friends who just every time they try to get back to benching, they have shoulder issues, just consistently. Every time they've gone to physical therapy, and anything that gets heavier, they have problems. And so, I mean, do you run into these issues where it's just like, I don't know what else to tell you? Maybe you see a surgeon or something, like you're just stumped?
Yeah, I mean, it happens all the time. Usually, so first I want to see like what their goal is. So if their goal is just for hypertrophy or bodybuilding or just overall health, if we get down that road of trying all those different options and nothing seems to work, and that's not something that happens often. Usually, I would say vast majority of the time, we can make some improvement and find our groove before we get to this last stage. But it does happen. And when we do get to this spot, then we have to ask the question, okay, do we need to barbell bench press, or can we do like a dumbbell bench press, or can we do a machine chest press? Like, can we try some of those things? If we've tried all those things and we've tried different, I've even had people who have issues benching where we go so far down as just isometrics, like load up the bar at the end range position and just press with 50% effort into the bar for a couple of seconds and then relax, because at least we're exposing the shoulder to that sensitive area. We're still loading it, but we're not provoking that pain. And then we've kind of just worked up from those like intermittent isometrics at different ranges of motion. But if we even try that and the thing is just flared up, or another example would be my brother. So my brother is a carpenter, and he was dealing with some shoulder pain. Dove into his and he trains not super like regimented like a bodybuilder would, but he works out probably more than the average person. Dove in his program, modified some of the movements, gave him some things to do at home to help with some like mobility stuff in the short term before he works out. And then he would, tell me at the end of the week, 1 week it feels great, and then next week, oh man, it's killing me. I don't know why. What did you do this week? Oh, I carried 20 sheets of sheetrock up to an attic, and then I carried my son and a diaper bag. So I'm like, okay, well, now that's a different human than what I'm imagining. This is not a bodybuilder that just works out every day. This is a father. This is a carpenter. This is someone who needs to work overhead. Some weeks it's someone who does more shop work another week, where he's working on like a table saw for most of the week. But his job fluctuates what he's going to require his shoulder to do. And all that is putting load on his shoulder. So I recommended he goes to see an orthopedic, and that's just what he did. And they evaluated him. X-rays were negative to rule out any kind of fracture or something, which we didn't suspect. They gave him an injection, and that seemed to help. And then he was back doing his training, and he was able to work without pain. So yeah, I think if you do get to that road of keep trying things conservatively and it's just not working, there comes a point where, are we wasting too much time living in pain when we shouldn't be leaning into some of these other more, I guess, not invasive, but more invasive than just modifying your training?
Yeah. So would you say that the type of, when you had to go virtual for COVID, would you say that the sessions that you had in your office or like from your office clients, were those very different than the 3DMJ crowd? I mean, obviously, I would assume the 3DMJ crowd is going to be much more into lifting, but would you say that the type of sessions are similar? I'm just thinking for people who maybe reach out to you if they're dealing with any orthopedic issues, kind of what they could expect if they were reaching out through 3DMJ.
Yeah. So with 3DMJ, usually we're not physically doing exercises on the call because they don't take me in the gym like with them. So we'll lay out a plan, and then we'll do some exercises. Like if I want to see them just do a movement pattern or a home exercise, if I want to see them just do something that I'm explaining to them, if I pull up a video and share my screen. So that's kind of what those consults will be. Kind of guide them in the direction. Because if they're a follower of 3DMJ, they're probably like 75% of the way there.
Mm-hmm.
And it's just me helping them, guide them to kind of give them a different perspective or offer some training modifications that maybe they didn't think of, or even some education. I know sometimes people don't know exactly what pain is and what pain isn't. So sometimes they come to me with one narrative that they think is happening, and I just offer a different narrative. So that can be really empowering too. The sessions with the patients from my office, those would be more let's go through the exercises in your house. Let's get that band out that I gave you. Let's get that chair that we've been using for our squats in your dining room and kind of go through the routine there. So yeah, the 3DMJ athletes usually, because their goals and their exercises are in the gym most of the time, they're more checking in with me week by week and just seeing how that week went. Sometimes they'll take videos and send me videos of them training, which is great because then we can look at them together and talk about it. So yeah, it really depends on the person and how much they need and how they best learn. That's one of the things I always say in the first email with an athlete is, I'm here for you. However you learn best. If you like more of a hands-off approach where you want to just reach out to me like through email once a week and that's it, or if you want to video chat with me every week and whatever, however you communicate best, I'm here for you. So it really is different for every person.
That's awesome, man. So, I know we're coming up on close to an hour here, and I want to be respectful of your time and everything. So for people who want to reach out, they can go on the website, right? Do you want to just name everywhere they can find you?
Sure, yeah. So 3dmusclejourney.com. So that's a number 3, letter D, musclejourney.com. My Instagram at Nick Licameli. Feel free to shoot me a direct message. Yeah, those are pretty much 2 big places. 3DMJ's Instagram, obviously, if you're not following them already. One of the best, if not the best, sources out there for this kind of stuff, and most people would not disagree with that they are, they're very well respected. One of my proudest moments was coming on that team because they've done so much for me in my own life. So to kind of carry that torch and maybe have a bit of an impact on our community is really, really cool. So yeah, I'd highly suggest checking them out or checking us out if you haven't. But yeah, all those places are good.
That's awesome, man. And my last question to wrap up on for you is just, obviously as a physical therapist, I think sometimes it's hard to be totally objective with oneself, right? Just like if somebody's training for a competition, to try to be their own coach. Some people do it. Do you find that if you are injured or if just you have some nagging pain, do you get in your head about trying to diagnose yourself? Does it become harder to be objective there?
Yeah, that's a good question. I don't try to overdiagnose myself, but I don't do what I would recommend all the time.
Yeah, yeah,
Like
sure.
I just push it because I want to just train, and then when my elbow is just on fire and I'm trying to rock my daughter to sleep, I'm like, why? Like I just don't understand. Like I help all these people every day. Like take your own advice. So
Yeah.
sometimes I like to just take a step back and think, if I was coming to me, what would I tell myself? And I actually have this conversation with my wife a lot, because early on with the kids, and it's pretty common for a new mom to kind of doubt herself and think she's a bad mom because the baby's crying.
Mm,
And I would say, look, if a new mother came to you and said, I think I'm a bad mom because my baby's crying in their crib, what would you say to them?
yeah.
And it makes a lot more sense when you think of it like that. So yeah, I think sometimes I am guilty of not following my own advice, but I think thankfully I haven't had any serious injuries. But there are things that pop up, and I've been able
Sure.
to manage them. So yeah, I'm my hardest patient.
Yeah, I think it's relatable for everybody, whether it's PT, dentistry, medicine, or even just as like coaching clients. You know, it's just very easy to say this is exactly what I recommend, and this is ideal. And then like there's real life and what happens. And I think just kind of being able to, be forgiving of those moments, right, and just understand that there's going to be some variation in how we handle things.
Yep, 100%.
Cool, man. Well, thank you for taking the time to join me. And you already listed everywhere that people can find you. So again, thank you.
My pleasure, man. Thank you for all you do in the space. You are one of the good ones, my friend. So thank you for everything you do.
Thanks a lot.